So in today's video, we will be exploring infertility, the key factors that affect reproductive health, and the different assisted reproductive interventions available to help individuals and couples achieve pregnancy. So we begin with the given case scenario. Encik Farid and Puan Sofia are a married couple in their late 20s who have been unable to conceive after 3 years of marriage. Encik Farid, as the male factor, presents with a low sperm count and poor sperm motility. He also has a left-sided testicular varicocele and history of testicular torsion during adolescence, both of which can impair sperm production. He has a long history of smoking and currently vapes, contributing to oxidative stress and reduced sperm quality. His hormone profile shows slightly elevated FSH with normal testosterone levels, suggesting impaired spermatogenesis with compensated testicular dysfunction. And as for the female factor, Puan Sofia, she has regular menstrual cycles, indicating normal ovulation. However, she has been diagnosed with endometriosis. She experiences painful menstruation and pain during intercourse. Ultrasound findings show ovarian endometriotic cyst, also known as endometriomas. These findings indicate an impaired ovulation environment and reduced fertilization potential. So in this case, both male and female reproductive factors contribute to infertility. Natural conception is reduced due to poor sperm quality and pelvic inflammation caused by endometriosis. The management approach includes evaluation of the underlying reproductive mechanisms, and assisted reproductive technologies, or ART, are recommended to improve the couple's chances of conception.
Next, we move on to the identification of the reproductive conditions that may affect fertility. As we can see, it involves both male and female factor. Encik Farid represents the male factor, and Puan Sofia represents female factor. As for Encik Farid, he has a low sperm count, meaning his sperm concentration is below the normal reference range. He also has poor sperm motility, which reduces the ability of sperm to swim effectively towards the egg. The presence of a left-sided testicular varicocele increases testicular temperature and further impairs sperm motility. In addition, his history of testicular torsion may have caused permanent damage to testicular tissue, leading to reduced sperm production. Long-term smoking and current vaping contribute to oxidative stress and damage sperm DNA. His slightly elevated FSH level suggests compensated testicular dysfunction, indicating that the tests are under stress to maintain sperm production. As for Puan Sofia, she has endometriosis with endometriotic cysts present on her ovaries. She experiences dysmenorrhea and chronic pelvic pain, which indicate ongoing inflammation that can negatively affect fertility. She also reports pain during intercourse, dyspareunia, which may reduce the frequency of intercourse and lower the chances of natural conception.
Hi, my name is Khairul, and now I will explain to you how testicular varicocele and a history of testicular torsion can affect male fertility. First, testicular varicocele is a condition where there is abnormal dilation of the vein in pumpiniform plexus. This condition increases the temperature within the scrotum, which disrupts the normal process of spermatogenesis. In addition, varicocele causes oxidative stress, leading to the damage to sperm DNA and reduced sperm motility. Poor venous return also reduces oxygen and nutrients supply to the testes. As a result, men with varicocele often has a lower sperm count, poor motility, abnormal sperm morphology, and reduced fertilization ability. Next, a history of testicular torsion can also severely impair fertility. Testicular torsion occurs when the spermatic cord twists, cutting off the blood supply to the testes. This causes ischemia and can lead to permanent tissue damage. Damage to the seminiferous tubule reduces the capacity for the sperm production. Even if the torsion is surgically corrected, the affected testis may undergo atrophy, resulting in reduced function. In some cases, torsion may also trigger an autoimmune response, leading to the production of anti-sperm antibodies. Consequently, sperm production and sperm quality are significantly reduced. In conclusion, both testicular varicocele and testicular torsion negatively affect spermatogenesis and sperm quality, ultimately reducing male fertility.
How endometriosis disrupts ovulation and fertilization. This slide is explained about physiological mechanism with ovulation and fertilization. Now it's starting with ovulation. On ovulation, endometriosis can cause the formation of endometrial cysts on ovaries, also known as endometriomas. These cysts damage ovarian tissue, which reduce the number of healthy follicles available for ovulation. So, at the same time, chronic inflammation increases the production of pro-inflammatory cytokines. These substances interfere with the hormonal signal such as FSH and FSH. They are essential for follicle development and ovulation. In addition, the scar tissue and adhesion may form around the ovary by trapping the oocyte and preventing proper egg release. Now, it's moving on the fertilization. So, inflammation caused by endometriosis alter the peritoneal fluid in the pelvis, it making toxic both sperm and egg. It reduces sperm mortality and decreases oocyte viability. Endometriosis also leads to disrupt pelvic anatomy, especially through the adhesion around fallopian tube. This adhesion impairs the transport of the oocyte and reduces ability of sperm to reach the egg. Even in fertilization occurs, the inflammatory environment can lower the oocyte quality, which negatively affects early embryo development. So, in conclusion, the endometriosis reduces the chance of natural conception by affecting egg quality, ovulation, sperm transport, and fertilization through the both inflammatory and structural mechanism.
And now, let's discuss about the assisted reproductive technology or ART that are suitable for this couple. Assisted reproductive technology refers to the medical procedure that assists conception by handling sperm, oocyte or embryo outside the human body. In the case of Encipharid and Poinsettia, ART can help overcome both male and female infertility factor. First, in vitro fertilization or IVF is a commonly used ART method. IVF involves stimulating the ovaries to produce multiple oocytes, retrieving these oocytes, fertilizing them with sperm in a laboratory, and transferring the resulting embryo into the uterus. IVF is particularly relevant for this couple because endometriosis can distort pelvic anatomy and interfere with natural fertilization. IVF bypasses the fallopian tube and the pelvic environment entirely. In addition, a moderate male factor infertility can still be managed through IVF if an adequate number of mortal sperm are available. The success rate of IVF is typically around 30 to 45% per cycle in women under the age of 35, although the rate may be lower in cases of severe endometriosis. Next, intracytoplasmic sperm injection or ICSI is another suitable option. ICSI involves the direct injection of a single sperm into the cytoplasm of an oocyte. This method is especially appropriate for this couple due to Encipharid's low sperm count and poor sperm motility, which are likely caused by varicocele and previous history of testicular torsion. ICSI reduce the need for sperm motility in achieving fertilization. Fertilization rate with ICSI can reach approximately 60 to 80% for of injected oocyte, with pregnancy rate that are comparable to standard IVF. In addition, if sperm quality from ejaculation deteriorate further, sperm retrieval techniques such as testicular sperm extraction or TESE can be used in combination with ICSI. Finally, frozen embryo transfer or FET allow embryo created through IVF or ICSI to be frozen and transferred at the later time. This approach enables better optimization of uterine condition and is particularly beneficial for women with endometriosis-related inflammation. In conclusion, a combination of IVS, ICSI, and supportive techniques such as sperm retrieval and frozen embryo transfer provide the most effective reproductive strategy for this couple.
Now, we are about to see how the ART is supported by the evaluation of lifestyle modifications, surgical correction, and counseling and psychological support to improve fertility outcomes. For Chick-Farid and Poinsavia, assisted reproductive technologies, or ART, are important in achieving fertilization. However, ART works best when combined with lifestyle changes, surgical treatment, and psychological support. These measures help improve gamete quality, hormonal balance, and the overall reproductive environment. Lifestyle modifications. First, lifestyle modification plays a key role. For Chick-Farid, stopping smoking and vaping helps reduce oxidative stress. This leads to improvements in sperm count, sperm motility, and sperm DNA quality. For Poinsavia, maintaining a healthy diet and managing stress helps reduce pelvic inflammation. This improves oocyte quality and increases the chances of successful implantation. Surgical correction. Next, surgical intervention helps correct physical problems affecting fertility. For Chick-Farid, varicocelectomy lowers testicular temperature and improves sperm production and motility. For Poinsavia, surgery for endometriosis removes cysts and adhesions, helping to restore normal ovarian function and pelvic anatomy. Counseling and psychological support. Finally, psychological counseling is an important supportive measure. It helps reduce stress and anxiety related to infertility, supports hormonal balance, and improves treatment compliance. It also strengthens emotional well-being and cooperation between the couple during ART treatment. So in conclusion, combining ART with lifestyle modification, surgery, and psychological support significantly improves fertility outcomes for Chick-Farid and Poinsavia.
Overall, this case demonstrates how infertility is rarely caused by a single factor, but rather a combination of physiological, lifestyle, and emotional influences. And Chick-Farid's compromised sperm quality and Poinsavia's endometriosis together reduce the likelihood of natural conception. However, with the use of assisted reproductive technologies such as IVF and ICSI, along with lifestyle improvements, appropriate surgical interventions, and psychological support, these challenges can be effectively managed. A holistic and multidisciplinary approach is therefore essential in improving reproductive outcomes and increasing the couple's chances of achieving a successful pregnancy.